Spotlight, presented by Community Health Network.
More than 300,000 people in the United States will be diagnosed with breast cancer this year, and it's not just a disease that impacts women. Almost 2,800 men will be told they have it, and for them, the diagnosis is commonly made after the cancer has spread. But now a theory from Farmers is hoping to change how men and women with breast cancer is treated. News 8's Brittany Noble has details in today's Health Spotlight.
University of Utah neurobiologist Christopher Gregg has dedicated his life to studying human genetics, but little did he know he would become his own lab rat.
As somebody who does run a lab with many lab mice, the irony has not been lost on me.
Professor Gregg was diagnosed with breast cancer.
I woke up one morning and my nipple was bleeding.
After a mastectomy, he was told the cancer was gone. Then 8 years later, an MRI revealed a large tumor on his hip and spine.
I knew that a stage 4 diagnosis with metastatic disease in different sites was a terminal diagnosis. I knew right away.
Professor Gregg gathered the top experts in the field and found new ideas that would change the course of his treatment. Those ideas were based on how farmers protect their fields from pests.
You rotate the chemical classes of the pesticides, so you're never chronically spraying with the same chemical until everybody develops resistance.
So he brought these crazy ideas to me, and they made sense.
In 2018, Professor Gregg started Extinction Therapy, rotating already approved FDA medications before his cancer developed resistance.
The key is that I never progressed or became resistant to 11 different drugs over all of those years.
He's doing better now than I would expect for somebody who's out as far as he is.
Professor Gregg's team created an algorithm using AI to accurately measure a patient's symptoms.
We don't need another $1 billion drug that costs a patient $20,000 to $30,000 a month to treat their cancer. The dream is a very cheap algorithm that works through your smartphone and tells you exactly when and what to take and how much.
Turning a lethal cancer into a manageable chronic disease. I'm Brittany Noble for Wish TV, wishtv.com, or follow us on Facebook for updates.
Professor Gregg and his team will continue to develop the tool, using it in clinical trials starting later this year. He hopes to make extinction therapy available to cancer patients in the next 3 years.